Hi, I'm Dr. John McCaskill. I have been invited to speak at the 2013 annual Michael Goelz Memorial CHAD ADHD Conference, and I'm very excited to talk about a topic that is very, very fundamental, very important, and really one, I think, of the most hottest topics in the field right now, which is the differential diagnosis and then the intervention planning that follows from that for ADHD and very commonly co-occurring conditions, or conditions which oftentimes can look like ADHD but really in fact may not represent ADHD at all, especially in young children where there is still very active neurological development going on. There are a wide variety of issues, symptoms, conditions that look a lot like ADHD, but which may or may not actually represent that. Things like the early manifestations of learning disorders, anxiety, other emotional and behavioral challenges, or just normal variations in development, depending on the age of the child, depending on what school they're in, depending on what curriculum demands are being placed on them in school, depending on what their life circumstances are at home. Children can oftentimes behave in ways, especially when they don't have the language skills to express exactly what they're reacting to or what they're thinking or feeling or what they're needing. They oftentimes can act in ways that look a lot like ADHD. And sometimes, yes, the behavioral challenges do represent ADHD, but a lot of times they don't. Or they might represent a couple of different conditions going along at the same time, including ADHD. So one of the most important things that I'm asked to do as a pediatric psychologist is to do what's called a differential diagnostic evaluation, where we identify what the overall pattern of symptoms represent. We understand more about what the child's functional pattern of strengths and weaknesses is and what those things represent diagnostically. So we try to answer the question of A, what is this? B, is it ADHD? C, if not, what is it? And then D, are there more than one condition going on? And then from that, then talk about the right types of treatment interventions, whether that means emotional and behavioral treatment, whether that means medication treatment, whether that means specialized educational services, tutoring services, school accommodations, or any combination of those things, depending on what the issues are and what they aren't, can call for some combination of those factors. And it's important to put the right ones into play so that you can deal with the problems most efficiently, circumvent the development of larger problems, keep things from becoming worse than they really are, and help the child develop the skills to go on and succeed, to be a just very happy, healthy, productive child and member of society. And in the end, that is what it's all about. So I'm hoping that you will be able to come in and join us at the conference and listen as I talk about the procedures for doing these differential evaluations and the different types of treatment implications, the things that work, the things that don't, depending on what the issues are and what they're not. We're going to spend a lot of time trying to disentangle those things, and I hope that you'll join us for that. Thank you.